10 diseases that remain silent until detected through examinations. It's possible for an individual to lead a seemingly healthy life for years and then suddenly receive a diagnosis of an advanced stage pathology. In this video we will respond to these inquiries and discuss the transformative impact of small preventive measures, which have the potential to save lives and significantly enhance the quality of life. Furthermore, we will demonstrate how a straightforward visit to the ophthalmologist can unveil more about your overall health than you might anticipate. The deterioration of the clinical condition directly results from this delay, particularly evident in diseases such as cancer, where the likelihood of metastasis substantially rises. Diseases left undiagnosed and untreated can impact multiple organs, resulting in irreversible harm, as seen in conditions like hypertension and diabetes, which carry the potential for severe complications such as brain damage and the risk of limb loss. 10 diseases revealed only through examinations. 1. Kidney diseases. Chronic kidney disease, CKD, poses a significant health challenge, manifesting as a silent yet severe condition impacting the vital functions of the kidneys, responsible for toxin elimination and maintaining the body's acid-base balance. Early detection is achievable through specific examinations, including urine analysis and measurements of creatinine levels in the blood, pivotal indicators of kidney function. Interpretation of these tests by a nephrologist is crucial for guiding the subsequent treatment plan. While a definitive cure remains elusive, underscoring the importance of regular health examinations becomes essential for preventing the severe complications associated with chronic kidney disease. 2. Cardiovascular diseases, hypertension, and cholesterol. Complications arising from conditions such as high blood pressure and elevated cholesterol levels play a pivotal role in cardiovascular health, standing among the primary causes of stroke, CVA, an event with potentially fatal outcomes. High cholesterol, notably one of the perilous silent conditions, becomes detectable through routine blood tests, facilitating the prescription of specific treatments upon diagnosis. Likewise, hypertension, a significant risk factor, is identified through blood pressure measurements conducted by healthcare professionals using appropriate equipment. These diagnostic approaches are critical for averting more serious issues, enabling timely medical intervention in the initial stages. This early intervention is vital to mitigate severe consequences such as stroke, emphasizing the necessity of regular medical checkups and vigilance toward health conditions that often remain concealed until they lead to significant complications. 3. Colon cancer. Colon cancer is a surreptitious condition that frequently progresses discreetly, devoid of obvious or distinctive symptoms during its initial phases. Emphasizing the importance of promptly identifying this type of cancer, the National Cancer Institute, INCA, asserts that early detection significantly augments the chances of successful treatment. To achieve this, a series of examinations is recommended, encompassing clinical assessments, laboratory tests, endoscopic procedures, and radiological studies. Biopsy, a procedure involving the collection of a tissue sample from the suspected area for pathological analysis, is often utilized to confirm the presence of the disease. 4. Osteoporosis. Osteoporosis is another ailment that unfolds silently, often surfacing only after a minor traumatic incident, like a fracture resulting from a seemingly minor fall. This condition is primarily linked to a decline in estrogen levels, a pivotal hormone crucial for maintaining bone density. The hallmark of osteoporosis is the pronounced fragility of bones, rendering them thinner and more susceptible to fractures. Diagnosis involves a specific examination known as bone densitometry, which evaluates the presence of calcium while measuring bone density and mineralization. This test is essential for pinpointing osteoporosis, enabling the implementation of therapeutic approaches focused on fortifying bones and averting fractures. Underlining the significance of preventive examinations for the early detection of this condition, which significantly impacts the quality of life for those affected. 5. Liver diseases. Hepatic steatosis, commonly known as fat accumulation in the liver, falls within the realm of silent liver diseases, posing a challenge for early diagnosis due to the absence of specific symptoms in its initial phases. This condition, characterized by an excess of fat in liver cells, can advance without overt signs, making identification difficult until symptoms arise. When symptoms do appear, they often mimic those of other medical conditions, leading to a delay in proper recognition and treatment, thereby jeopardizing early intervention. The emphasis on regular examinations and medical follow-ups is underscored by the necessity to identify and manage hepatic steatosis before it evolves into more severe conditions, highlighting the importance of maintaining vigilance for optimal liver health. 6. Glaucoma. Glaucoma, a severe eye condition impacting the optic nerve, stands as one of the primary causes of global blindness. Notoriously discreet in its initial phases, glaucoma advances without evident signs, allowing a gradual and irreversible loss of vision to occur before detection. The absence of noticeable symptoms in the early stages complicates the timely recognition of the disease, necessitating ophthalmological examinations. During these examinations, the ophthalmologist assesses intraocular pressure, a crucial indicator for diagnosing glaucoma. While the condition itself cannot be reversed, prompt identification and treatment can manage its progression and diminish the risk of substantial visual impairment. Hence, maintaining vigilance over eye health and undergoing specialized examinations at regular intervals are indispensable in averting the more severe consequences of glaucoma. 7. Prostate cancer. Prostate cancer, prevalent among men and situated in the prostate gland near the bladder, stands as one of the most common cancers in this demographic. Its subtle nature becomes apparent during the initial stages, presenting a challenge for early diagnosis without specific examinations. To facilitate early detection, the PSA, prostate-specific antigen, blood test and digital rectal exam are strongly recommended, particularly for those aged 50 and above. These preventive measures play a crucial role in identifying the disease at a stage where treatment can be more effective and less invasive. The discourse on prostate cancer, along with other silent diseases mentioned, emphasizes the indispensable role of regular health screenings. These checkups gain heightened importance with advancing age, aiming for the early diagnosis of medical conditions that, if not identified and treated promptly, may progress to more severe stages. The establishment of a routine medical assessment, therefore, becomes a fundamental pillar in the prevention and effective management of diseases, ensuring a higher quality of life and well-being, especially in old age. 8. AIDS. AIDS, short for Acquired Immunodeficiency Syndrome, is a grave condition caused by the human immunodeficiency virus, HIV, categorized among sexually transmitted infections, STIs. Transmission can occur through various means, including transfusions of contaminated blood, unprotected sexual relations, and other activities involving the exchange of infected body fluids. HIV has the ability to assault the immune system, leading to the destruction of T lymphocytes and other vital cells crucial for the body's defense. This significantly heightens the risk of secondary infections, such as hepatitis and pneumonia, among others. A concerning aspect of AIDS is the potential for carriers to unknowingly transmit the virus, given the often asymptomatic nature of the disease in its early stages. These increasingly effective treatments are vital for controlling the virus's progression. 9. Diabetes. Diabetes is a prevalent health issue affecting approximately 6.9% of the global population, equating to about 537 million individuals. This metabolic disorder presents in two primary forms, type 1, typically diagnosed in childhood, and type 2, which tends to manifest and be identified later in life. Type 2 diabetes, in particular, is insidious, with symptoms that can be subtle and gradually progressive, including increased thirst, frequent urination, and fluctuations in weight. The seemingly mild nature of these symptoms often leads individuals to live with the condition for years without formal diagnosis, heightening the risk of severe complications. Thus, upon recognizing the condition, it becomes crucial to implement effective management strategies, encompassing regular monitoring of blood glucose levels, adherence to a balanced diet, and consistent physical activity. These measures not only aid in controlling the advancement of diabetes but also play a role in averting its more severe complications, underscoring the importance of a proactive approach to health and well-being. 10. HPV. The human papillomavirus, HPV, ranks among the most common sexually transmitted infections, STIs, spreading not only through sexual activity but also via contact with contaminated surfaces. Its predominantly asymptomatic nature means infected individuals can unknowingly transmit the virus, posing significant challenges for prevention and early diagnosis in the battle against HPV. In women, HPV may not exhibit visible symptoms, but in some cases, it can lead to the formation of warts or polyps in areas such as the urethra, anus, uterus, and vagina. Early treatment is vital due to HPV's potential progression to more severe conditions, notably cancer, particularly cervical cancer. For prevention, regular examinations such as the Pap smear and colonoscopy are recommended to detect cellular changes indicative of HPV infection. Similarly, men infected with HPV may develop warts on the penis, scrotum, or anus, although many may remain asymptomatic. Prevention through consistent condom use in all sexual encounters is crucial to reduce the risk of transmission. Additionally, specific examinations like peniscopy are available for men who suspect exposure to the virus. Therefore, awareness of HPV, prevention through safe sexual practices, and the importance of regular screenings are crucial in reducing the prevalence of this STI and its potentially severe health consequences. Did you find the video informative? If yes, please subscribe to the channel, like and share for more health topics. Thank you.